3 minutes. Please keep that in mind.
Okay, thank you for. Mitochondrial disease are a clinically heterogeneous group of disorders that arise as a result of dysfunction of the mitochondrial respiratory chain. They can be caused by mutation of genes encoded by either nuclear DNA or mitochondrial DNA. There is multi-system involvement with tissues with high energy demands being particularly vulnerable. However, there had been no studies evaluating changes in lower urinary tract functions in mitochondrial disease. Recently, we have shown that patients with mitochondrial disorders experience more lower urinary tract symptoms compared with healthy controls. However, the pathological basis for lower urinary tract dysfunction is poorly characterized in this group, so we evaluated it. 15 patients with mitochondrial disorders and lower urinary tract symptoms were recruited. Mutation were shown in this slide. These patients were evaluated by urophometry and/or measurement of post-void regional urine volume. And in some cases, we also evaluated some patients by multi-channel urodynamic study. This is result about urophometry. Mean Qmax is normal range, but low Qmax was shown in 3 patients of 12 patients. And also, abnormal uropro curve was shown in 6 of 12 patients. These findings suggest that decrease in uropro is common in this disorder. This is result about PVR. Mean PVR is 87 millimeters. Over 30 millimeter PVR is shown in 7 of 14 patients. And also over 100 PVR is shown in 5 of 14 patients. So increase in PVR is common in this disorder. This is results for about multi-channel UDS in 4 patients. Stage phase detrusor overactivity is shown in 1 patient, and also increased bladder sensation without detrusor activity is in 1 patient. Whereas during voiding phase, low Qmax 3 of 4 patients, and abnormal period curve is shown in all patients, and age number is normal in all. So in this order, steroid dysfunction is not rare, and detrusor underactivity without bladder outlet obstruction is common. This is a preliminary study. The cause of lower urinary tract dysfunction is uncertain. In conclusion, significant pathophysical changes in lower urinary tract control are seen in patients with mitochondrial disorders. That's all. Thank you for attention.
Thank you very much.
Thank you very much.
Floor is open for discussion. Yes, please.
Sakakibara from Japan. Thank you very much for a really interesting paper. I think it's the first study to see what's occurring in the bladder. And the one thing I was wondering about the you show a variety of urodynamic or questionnaire and this dysfunction, and there are several patients with large possible residuals, and I think it may reflect the sacral cord or peripheral environment. How do you think about the site of lesions in these patients? If you perform some test, such as a nerve conduction or MRI or something like that, could you show me about that?
In this study, we didn't experience clinical feature for these patients. So I don't know about your question. But mitochondrial disease affect the variable many organs. So it may be a cause of lower urinary tract dysfunction, as you mentioned.
Next question, please.
Hi, Israel Franco from Yale. I'm a pediatric urologist, so I see a lot of children with mitochondrial disorders. What was the average volume when you did the uroflows? Because by saying that a mean flow rate of 20, a mean flow rate of 20, if you calculate that, actually corresponds with a volume of 200 cc's. You would expect that, okay? So, and these patients almost always have large bladder capacities who have mitochondrial disease. So, just by the fact that they have a elevated bladder capacity, their average voided volume is going to appear to be in the normal range, but your urodynamic data all shows that they have a tendency to have underactive bladder, which is what we see pretty much in all the pediatric mitochondrial disease patients as well. So, I mean, this is the problem with reporting average flow rates or Qmax flow rates isolated without measuring the volume. What was the volume in your group, of the voided volumes?
You mean bladder capacity is larger than normal control?
Right. Was it large?
No. In a few cases, we experienced it. Bladder capacity is not larger than usual bladder capacity.
Okay. Thank you very much. I think for the interest of this paper, you should compare it with a normal group, age paired and sex paired. Otherwise, it looks like difficult to analyze this data. But we have to finish here and continue to the next paper.
Thank you very much.
Thank you very much.